Greetings to everyone and welcome to this panel session, which is on women in the health industry fighting COVID-19. And I think you'll all agree with me that it's a very important session. Given that we're all fighting COVID-19, it's something which has impacted probably every single person on the planet. It is first and foremost a health crisis. But COVID has also created an economic crisis, a social crisis, and an environmental crisis. And I was very interested to hear Natalia say that there are now more single-use masks in the ocean than there are jellyfish. So that's quite amazing. But the thing is that COVID has very much impacted women in a very disproportionate way. And again, referencing Natalia, so thank you. 70% of women are at the forefront of the health industry and are fighting COVID. And I suspect that there's also a disproportionate impact on women as patients and probably as carers. And I think it's very important to always remember the carers that come through the health industry. So we're very lucky today. We have a distinguished panel, and I apologize in advance because I'm sure I'm going to mispronounce your names. We have Dr. Yu-Ying, we have Dr. Anita Munneke, and Dr. Yahra Zamzam. So unfortunately, Natalia Dayan hasn't been able to join us today. So I'm going to start with Dr. Chu. She is attending physician, Division of Trauma and Emergency Surgery in Taiwan. So over to you, Dr. Chu.
Hello, can everybody hear me?
Yes, yeah, we can hear you.
Okay. So I'm going to share it. I'm going to share. Okay. Okay. Can everybody see my PowerPoint?
Yep, that's fine.
Yep. Okay. Okay. Is that clear? Okay. Okay. Thank you, everybody, and I'm very happy to have you to join this panel. And I'm Munneke Yu-Ying from Taiwan. And today it's my really great honor to be here to share the Taiwan motto for combating COVID-19, and hope you enjoy my brief presentation. Sorry. Okay. Is that okay for you? Okay, this is my profile. I'm the plastic and reconstructive surgeon who work in Chang'an Memorial Hospital in Taiwan. And my subspecialty are craniofacial trauma, extremity trauma, microsurgery, burn surgery, and some cosmetic surgery. Though I need to apologize that I'm actually not the first line physician who really combat COVID-19, but I think as the medical provider and the Taiwanese. So I really would like to share the most brilliant parts of Taiwan's government in terms of this pandemic control. Okay, and pardon me to declare that all the informations that I present now were cited from the website of our Ministry of Health and Welfare of Taiwan, and we just brief it into mo.hw. And if the audience have interest in it, and here is the keywords for internet search, crucial policy for combating COVID-19. But don't worry, there's English version. Okay, so here is the trend of COVID-19 cases until yesterday. And you can see the red line showed the global victim numbers, and the green column represented Taiwan's data. Okay. And till yesterday, the total cases number globally was almost 54 million people. However, in Taiwan, we only had 600 cases. So how do Taiwan make it? I think you must be very curious about that. Okay, let's see this guy. Okay, this guy is our Minister of Health and Welfare, and he's also the commander of CECC. The CECC refers to the Central Epidemic Commander Center, and since January 23rd, every afternoon, almost every Taiwanese started to follow the official press conference for the latest information of COVID-19. The contents includes the most updated case number, the global situation, and the new mask delivery policy in detail. And the following sequence of the slides were published on the website of our Ministry of Health and Welfare. This is the profile of Taiwan. We own 36,000 square kilometers land area and about 23 million people, which the 14.56% of them over 65 years old. The average life expectancy is about 80 years old. In Taiwan, we have national health insurance systems. We just call it NHI, and every system is insured. They paid premium to the NHI and receive the NHI cards for multiple usage. And they also copay to the healthcare providers, and the healthcare providers receive the payment from the NHIA, and they need to claim. But how do NHI system and NHI cards facilitate the control of pandemic in Taiwan? You must be very curious about that. Here, I would like to mention the key elements of Taiwan models. Their advanced preparation and early response, and the help of big data and AI, the transparency, and I'm going to discuss these three elements in detail. So first, for the advanced preparation and early response, the organization structure of Central Epidemic Commander Center was built early, which includes intelligence section, operations section, logistics section. And for the intelligence sections, we have epidemic intelligence group. And for operations sections, we have border quarantine group, community epidemic group, healthcare response group. And for the logistics section, we have resource coordination group, R&D group, information management group, administration group, public information group, and also the legal affairs group. We develop measures for inbound travelers, like check before boarding, onboard quarantine announcement, home quarantine notice, fever screen, special taxi or rent a car for transportation, and home quarantine for 14 days. And we also have solid case investigation. We have contact tracing, care support services, such as local hotlines, meal delivery, garbage collections, also settlements, family visit, designated ambulance, non-suspected symptoms, or medical care arrangements. And here I want to mention about the importance of NHI cards that we mentioned previously. And it helped us to build up the big data and could be processed by AI. And this smart little card record the immigration and custom data. And this could be used as the tracing and monitoring the health condition of our citizen. So it is actually very useful. And the third key element is transparency. And I think this is the most important part. The CECC announced their policy and information related to the pandemic every single day. And they release it via social media, press conference, and television, so on, hotline. And almost every Taiwanese people liking watching a popular drama which plays by our Minister of MOHW. So this is quite interesting. And the government also educate people to wear masks, to keep the ideal social distance, to wash hands in correct way, and to publish it by poster, video, even new media. And here you can see that we learned from SARS experience. We learned three crucial things. I'm not quite sure that does everybody still remember the period of SARS. Actually, it is also the coronavirus. And we have regulatory review of SARS experience and amends the Communicable Disease Control Act. And we have organization adjustment, and the National Health Command Center was also established on January 18th in 2005, and they have complete epidemic prevention system. And we have practical operations, and we review the weakness in the epidemic prevention system through the National Plan for Prevention and Control of Communicable Disease. And another that I want to mention is this one. For the smart community transmission prevention, we employed the NHY big data to help frontline workers detect cases, and adopted technology to strengthen the isolation and quarantine measures. We applied the technology to help enforce the home isolation and home quarantine. So through the digital fencing tracing system, we cooperate with the telecom operators. The locations of people in home isolation and home quarantine can be monitored by detecting the electromagnetic signals of their mobile phone to determine whether they leave the range of their home. So this is quite important because people need something to watch them. And people in Taiwan are wearing masks every day. And this is actually very amazing because I know that some countries, they don't wear mask at all. And everybody has the consensus to wear the mask in the public. And we know that to wear the mask is to protect each other. So no one will be bullied or no one will be left. And we have this NAM-based mask distribution system. And this means that we have good resources allocation, and we supply the inventory and dispatch of epidemic prevention. The fast masks are requisitioned and reasonably distributed by the government. And we increase the availability of epidemic prevention supplied through multiple channels. And we monitor healthcare and testing capacity, and also reserve the sufficient healthcare panel and our government affiliated hospitals on the front line. So these are key success factors, and not only the mentioned factors above, but also the other reasons which lead to this success to the combat. We learned from SARS experience in 2003, and we have good resources allocation, the timely border control, the smart community transmission prevention, the advanced medical technology, and also the good etiquette of our citizen. So the aforementioned are Taiwan's experience. Thank you very much for the listening, and I hope these Taiwan experiences will also work in your beautiful countries, and they may change the condition of pandemic. We believe that Taiwan can help, and Taiwan is helping. Thank you.
Right, thanks, Dr. Chu. And I know definitely from my own reading that Taiwan has done an absolutely extraordinary job of containing the pandemic. And I think Taiwan is very much the envy of many other countries. So we watch with great interest to see what it is that Taiwan is doing. And your very comprehensive model and the description that you gave us is very informative. And I think the early response and the lessons learnt have been really, really useful. And I think that's something that a lot of other countries struggle with, including my own, Australia, just learning the lessons from previous experience. So I think there are many lessons in what you've just described for other countries, including the use of technology in fighting the pandemic and incorporating it in the health industry. And I know that definitely one of the things about COVID is that it has accelerated the use of technology in the health industry. For example, things like telehealth. So thank you very much for that informative presentation. Okay, I'm going to pass over, thank you, over to Dr. Anita. Over to you. And I should say you are cardiac surgery resident in Germany. Is that correct?
Yeah, that's correct. Can you hear me?
Yes, we can hear you.
Okay. I now still see the screen of Yu-Ying. Do you have it still open? Or, yeah, okay. I will open my own presentation in a moment. Yeah, I grew up in Holland and I moved to Germany about 6 years ago. And I moved to Germany 6 years ago for the training in cardiac surgery. And it was a very chaotic start because I didn't speak the language and you move to another system, another country. And that was very exciting. And soon I realized that the healthcare structure in Germany is totally different compared to Holland. And it was really a struggle to start and to find the challenges. So at some point, we ended up in the hospital because of not good management regime of the hospital. We have every year a new reorganization, a new management, and also new concepts and ideas of people, and that was breaking up our team a lot. And I got lost in my training because training is at that moment not a priority anymore because you have to let the business and the company survive that change management. And then I faced the problem that globally there are only 3 to 5% female cardiac surgeons. And I was contemplating how to start, we talked about it yesterday, to start up building resilience. And I was totally lost in that system. So what happened? My first journey was to New Zealand and after that to Australia. And I found a gravel road in Australia and I was so annoyed that I could not drive that gravel road. And I thought I should not drive 200 kilometers extra on pavement and avoid that gravel road and missing the fun because I don't have the capacities. So I signed up for a one-day course and I thought I would have learned all the skills to start traveling in South America, Patagonia, Chile, and Argentina. Well, it was a big challenge because it taught me that we should never give up. And I ended up at Rhodes without preparation, without plan, just to escape all the reorganizations. And yeah, I just went. So sometimes you have to go and start. And that taught me a lot because I realized that the most difficult roads have many beautiful destinations. And I fell down, injured my ankle, injured my legs. Many things happened. And after 80,000 kilometers of driving across the globe, the journey just has started. And the solitude and scaling down from a complex society also drew myself back on myself and what are core values within myself, and getting away from a system that is so complex to perform in. And also a break of 80, 90 hours work weeks. What happened is I continued working and there was a sudden journey to Pakistan. And I was joining some terrific badass women with different jobs. And we were collecting our bravery together to educate teenagers, pre-med engineering school. Well, in fact, they taught us a lot. And what I found on a tiny note is that if who I am is what I have, and if what I have is lost, then who am I? And it doesn't matter how you feel, get up, dress up, and never give up. It was quite funny that at this stage of my life, the most important lessons I learned from a teenager of 14 years old in Pakistan. And interacting with these women, you see on the left corner, there is a group of women, the first 20 women learning how to ride a motorcycle and have their license in Pakistan. And then suddenly the question, your life in Europe, you have it all, you have all the chances. Yes, correct, I have the chances, but there's still a massive gender gap. And I will not talk about all the statements that has been thrown over me, but it was a very inspiring time in Pakistan. But unfortunately, the school we visited was burned down after several months because women still have to bridge many steps. But I continued, and from tiptoeing in my life, it became a tiptoe or a toe in China. And I figured out that we are breaking mainly the glass ceiling within ourselves, and we have to transform the vulnerability to strength as a woman. So during this journey, I met a doctor, and he said, contact Dr. Shetty in Bangalore. So some months later, an unexpected flight to Bangalore, a 7,000 operation hospital providing cardiac care. And I realized that the majority of the world does not have access to cardiac care like the full spectrum that we know in our Western society. And I found my purpose back because I was lost in that system. And a young man showed me some important lessons again, because he saved 20 years money to have his heart operation getting done. And it made me so humble that afterwards I came home, I gave away my car, I gave away 40% of my belongings, and I realized what is the essence of who I am. Later on, you interact all the training. You work in a hospital, you get to know people, you make friends across the globe. They have different professions, all amazing women and men together. We can work a lot together. And I realized I've become a mosaic of what everybody has taught me and have touched my heart, even if it's for a tiny bit. So I was intertwining work and traveling and curiosity, but I wanted more. So at that point, I thought I should register for the Leadership for Experts in Medicine and Healthcare at the University in Leipzig. Because I had so many questions that came up, why I have to learn so much from other countries, lessons I cannot learn in my own country, and how come people lose their passion and commitment in our society for difficult jobs within healthcare, and how to implement change. Why is it that so difficult? And why are systems, are they failing on people? And I see my beautiful colleagues losing their passion for their job that they chose out of, And why are women still a minority? And doctors are not well trained for leadership, for negotiations, and doctors can still not bridge the gap between management, business, and administration. I kept all those training and all those traveling for myself. I didn't share it at work. I took my overworked hours. I paid all my training myself in order to be independent and to first learn before saying I learned something or talking about it in advance. So wrapping up this story, I moved to Essen and I ended up in the Corona, COVID-19. And Essen is a beautiful place, 170 nationalities, and it's a nice city. But we ended up in Corona, and that affected us all together. And it's not important that we are battling COVID-19. I think we are not only battling it, but the virus also shows us that we are battling ourselves, society, and the systems. People are driven by fear and dopamine. The first weeks when COVID was being diagnosed, or we heard from it, 800 liters of hand sanitizer was stolen in the hospital. We could not perform the operations because the materials were gone. We had no surgical face mask, but there was also a lot of creativity to make things work. There was a disruption of the supply chain. Companies did not deliver their materials anymore, and that gave a very uncertain factor for us as healthcare providers. Because we got the feeling like we are providing healthcare, but what about our health if that's not guaranteed? We had to restructure healthcare, and elective planned operations needed to be postponed. And that created in the course of weeks a lot of loss of healthcare workers like nurses. 8.6% stopped. And the dysfunctional structures become even more visible. So I thought, how can we keep future generations passionate, especially the students? We have to train them. We have to learn them hand-on teaching what is now failing on them. How can we reduce the economic burden on society? And how can we consume healthcare and all what we have in a more conscious way? And what about quality? What is society willing to pay to live, to make one patient live 1 year longer? And can we pay that? We need a shift of mindset in our society, and we need to relearn how to listen to what is really important. In multicultural communities, I work with a lot of colleagues from countries all over the world. How can we create different perspectives and different solutions? And global training will increase our understanding, because if my neighbor in Pakistan is doing well, I'm also doing well. Because with more international traveling, you see what COVID-19 brought. So we have to reconnect through humanity again in order to find solutions. And like Yu-Ying said, we have the same kind of model like you implemented for SARS. 80% is about the same like you use in your country. We have 120 hospitals could reopen their emergency plan again in Germany. But what's happening? We have 28,000 ventilators, intensive care unit beds. And that's giving a burden of 84 million per day on healthcare to treat COVID patients. And not alone, we are not treating the people that are being planned for their actual operation. And overall, we have a big burden being created, and it's up to us as human mankind to reconnect and to solve problems in the future. So if you always have to nurture the inner child and remain curious for solutions, you always have to dream big and always embrace new journeys. So, that was the presentation. Thank you, Mark.
Thank you so much, Anita. That was fascinating, hearing about your own personal journey and adventures, the resilience you've built up over those 80,000 kilometers. I mean, that just sounded amazing, and some really fascinating journeys. And also deriving lessons from everywhere you've been and being so open-minded so that you can learn lessons even from a 14-year-old teenager in Pakistan. So I think that open-mindedness is a great lesson for the rest of us as well. And then also asking some of the big questions. So going from your own personal experiences and taking those, and then, you know, in your last few slides where you do pose those big questions, because I think there are lessons there for everyone. And there's one thing that COVID has taught us is that we rely on each other. And as you say, you know, we have to reconnect through humanity. So I think those are some of the positives that we all need to take. So thank you so much for those fascinating insights. That was really interesting. Okay, so our next presenter, Dr. Yahra Zamzam. So I will pass over to you. And first of all, I will just say that your title is Business Excellence Manager for the Dar El Fouad Hospitals in Egypt. So over to you. Thank you.
Thank you very much. Good morning, everyone. I'm Yahra Zamzam, originally a physician. And I have over 10 years of experience in the healthcare management field, working currently as the Business Excellence Manager at one of the tertiary care hospitals, JCI accredited ones in Egypt. I don't have a presentation. I have some problem. I will send it to you after. So what I want to say is that from the management perspective, this COVID problem has caused us all to open our strategies and to open all our risk management plans to find out what should we do, how should we handle our hospitals, how should we handle our patients. And believe me, none of any strategic plan and none of any risk management plan had any clue how to do this. It's something so new to the whole world that no one could know how to handle this major problem that we are facing. Like every country in the world and like every hospital in the world, emergency strategies had to be implemented. They have to be fastly thought of. And these emergency strategies were based on trial and error. We just try, what if we do this and what if we do that? What if we admit COVID patients? What if we don't? What if we give this protocol? What if we isolate the patients this way or another? It was really, really challenging at the beginning. The cost component and the effect on revenues, especially in the private sector, was enormous, especially in my country where there is no national health insurance system that covers the whole population. So this has been a really big challenge for the population as well as for the Ministry of Health that has to handle the enormous amounts of patients that get affected, and we don't have clear protocols or clear strategies to follow. So what I want to tell you today is how this COVID-19 disease has brought opportunities through women and through women entrepreneurs to grow and to find their way and to improve the overall quality of the healthcare system in the whole country, in the whole hospital, and hence in the whole country. First of all, it is very important for all of us, the patient's experience. A patient who comes with COVID at any hospital gets isolated. He doesn't talk to anyone except his caregivers, and he has no family to support. He knows he might end up with death, and he doesn't know if he will be one of the lucky ones who will survive it or not. His patient's experience is really bad. And Dr. Anita, you can confirm your patients, your cardiac patients, when they are in ICU, you're always afraid of ICU psychosis. Our COVID patients had pretty much the same. They were alone, no one to talk to. So we have to figure out something new for the patient. And the first thing that we came up with was we have to communicate with them. We have to make their experience in the hospital a pleasant one. So every patient got the chance to choose, what do you personally need? Some just needed a laptop to speak to their relatives over Zoom or over any video device. Others needed just some psychotherapy. Others needed just some caregivers to talk to them. We managed to give every patient a personalized experience so they can feel better during their very difficult time in the hospital. That was one thing. Another thing was the family. The family let their relative inside a hospital and they don't know anything about them. They're not allowed to visit them. They're not allowed to see them. Maybe they're not even allowed to know if he's good or bad. They either get a phone call, please come and pick him up, he's better, or we're very sorry, you lost your relative. So that was another challenging thing, especially during the very critical time when COVID was so active in the whole world. We handled them through telephone calls and through regular updates, updating their patients about their medical conditions. So that was a daily thing that we used to do for all the patients. And all this were suggestions by ladies in this hospital. Another point that is very important for the healthcare sector as well during this critical time was to find creative ways to make patients take the care that they needed in a one-stop shop. So that a patient comes and gets all what he needs once, and then gets out without having to go through many stations or many other facilities to get his whole services done. So we got the bundled services that a patient can come, gets all his consultations done, gets all his images, gets all his medications and everything that he needs, so that he doesn't have to have the risk of being exposed to COVID in different places that he needs. And again, these are done by ladies in this facility. There are lots of opportunities for entrepreneurs that were evolved during this critical times. There was a company, for example, that found the need that patients who are not medically insured and they get COVID or they get any other disease. And, you know, of course, during this time, many people have lost their jobs and they couldn't afford to finance their health-related problems. So a company came up with the idea to fund patients for certain interests or something like that. And this company did this job just for the COVID patients that need to be treated, so that they can help patients. Instead of dying at home, they can now afford the hospital and get their treatment done. Another challenge that we have faced as well was related to the supplies of the hospital. In every country, I believe there are factories that closed because of the COVID, or that they have reduced their supplying whatever they had to supply because of that COVID. Many places have shut down and many places have reduced their products because they could no longer afford, and people were staying at home anyways, except those hospitals. We could not close our doors for patients. We could not close the facility. We could not reduce the people working at the hospital. We have to protect them, and we had to protect our patients, because everyone gets back home for his family and we have to protect them all. So the supplies was a very big challenge. The stocks were challenging as well. We have seen videos all over the internet about basic supplies that are missing for household. Imagine that at hospitals. That was very challenging and very critical. All hospitals and the Ministry of Health in Egypt have cooperated to get all the supplies needed and to mass produce quickly and turn the factories to produce medical stuff that is needed at different hospitals, so the hospitals don't run short in supplies. So that was a workaround solution, of course, that the factories changed their products to other products. But again, it was very important for the sustaining of the hospitals. The employees and the doctors, and especially women working in this field, and you, of course, Dr. Chu and Dr. Anita, you know this better. When we go to hospital that treats COVID, and then we go back home to our family and to our kids. And our kids wonder why we cannot hug them and why we cannot spend lots of time with them, and we prefer to take some distance. And all that they hear is Corona, Corona, Corona. That was a really tough time and a really bad time. And for us women, it was really challenging. Again, it's all about finding opportunity in this critical time. There is always opportunity for growth, always opportunity for improvement, always opportunity to make correct plans for sustaining the business, for creating new businesses, and for protecting ourselves and our families. Now that we're going through a second wave in most countries, we have better plans. We have a better strategy. Now we have something written that we can follow. Now, when we open a COVID unit, we know exactly what we're going to do. It is now written. A year ago, there was nothing about that. Now we have risk management plans. Now we have companies that are trying to help patients and are trying to help factories improve. So our strategies have improved a lot by proper planning and by finding opportunities for sustainability and for excellence. Thank you very much.
Great. Thank you so much, Yahra. That was really, really interesting. And I like the way you focus very much on the opportunities and the positives, because I think one, you know, we say don't waste a crisis. So we all need to learn and take something away from COVID-19. And I think your focus on some of the opportunities was really, really interesting and very informative. And just all the new emergency strategies that you implemented in the hospitals. And I read with interest some of the improvements that you've made, and I assume they're going to be sort of long lasting into the future. The other interesting thing you raised was the issue of mental health. You know, you're talking about psychosis and the needs of the patients. And I think that's one thing that we've learned, certainly I know in my own country, and I assume in many others, that whole issue around mental health that's been really, really brought to the forefront with COVID, because it's not just a crisis about, you know, getting a virus and you know, possibly dying from it, but it's also the secondary sort of implications around mental health. And I read with alarm some of the statistics that are coming out of Australia alone about the people who are suiciding, and just huge, huge mental stress. So thank you so much for raising those issues. Okay, I think we have a question. Okay, particularly for Anita, the question from Nuf Nayadi is, your presentation reminded her of this quote: "As adults, we remain intrigued by those who look, believe, and behave differently to us. But unlike children, we are not brave in our curiosity. We are embarrassed by what we do not know and those who remind us of our ignorance. Yet, as was stated in the presentation, from curiosity, we could learn to cultivate an empathy for others. What consistently fuels your curiosity through your journey?" Great question.
Oh. That's a beautiful question. I think my fuel is that I grew up at a farm, and I was a girl with many dreams, but at that moment I did not have all the abilities to transform them, and I didn't even know them, that I had many capacities. I was not aware of them. Since I'm 16, 17 years old, I paid all my training and education myself. So I work hard for every single step, and that gives a real reward to you, because you realize things are not delivered on a golden plate. You have to work for them. And the more you invest of yourself, the more something will come back to you. I believe if you invest in the good things, even if it's very difficult, and I get remarks through my well, once you told me you will not become a cardiac surgeon, you will have to plan children, and I will stop talking here, because I had so many remarks and they made me so insecure. But my fuel is my interaction with people, because they have such an important life lessons for us to share. And it's not the highest management or the board of a hospital. It's the most like a monk in the Himalaya, and I drink a coffee with him, talking with hand and feet. And as long as you're curious, people are always willing to share something from them with you. And what I realize is that we are all very vulnerable, and we all want to connect with each other. And the more we connect, the more we can create something beautiful out of it. Even if it's not always easy and it's very difficult, but I try to let every journey and every work situation to intertwine with each other, to support me and climb up again. And yeah, I don't know, maybe Ying-Yu has another difference, or Yahra has a different answer. We all do it differently, but I like to interact with people. Their energy and what motivates them is driving, is pushing me to go on and on and on. And that's my motivation. Yeah.
No, that's terrific. Well, I might ask Yu-Ying and Yahra, what are your motivations? What inspires you? What keeps you going? What is your fuel? So I'll start with you, Yu-Ying. What's yours?
To keep going. Well, that is difficult. I need to say that sometimes you just need some patience, because sometimes you know that you actually don't really need the reason. For me, it's kind of patient. I feel it's like that. I don't know if Yara have better answer for this one. I just feel excited about that.
No, that's great. Excitement is all.
To me, thinking of what makes me most want to move or do something is finding a challenge. And I've never seen a challenge bigger than COVID.
Oh yeah. Yeah, you get the point. I think it's challenge, yeah. Because if you feel like this is really meaningful, you feel like it is really meaningful and really challenged, and you might be like heroine, and sometimes you think it's worth it to do.
Okay, so we have another question from Dia. Dia's question is to you, Dr. Chu.
Yeah.
She wants to know, are there any particular foods that you usually eat as a habit in Taiwan to increase your immune system?
Food? Actually, I don't really think that it is the foods that particularly in Taiwan that help for combat COVID-19. I actually don't think so. Food. I know that actually we eat lots of vegetables every day, but I think this concept is quite easy, and it is also like people in this Southern Europe, they eat lots of vegetables and they eat lots of fish oil. I think for the first is you need more vegetable, more how to say that? It's like you need something like get the fish oil in the seafood from the seafoods, and fruits, because we get lots of fruits in Taiwan. But I know sometimes it's very difficult for some countries to get many kinds of a variety of fruits. I think this. Okay, I need to say that I really don't think that food will change the combat of COVID-19. Actually, I don't know that if you feel satisfied with this answer or not.
Well, definitely a good healthy diet keeps you healthy overall and
Yeah, of course.
your immune system. So whether it's COVID or something else, at least you have a better chance if you're healthy and eating the healthy diet. In fact, Dia and I were in Taiwan, remember, a few years ago. We ate very, very well. I don't know if it was healthy, but we ate very, very well. It was good fun. Let's see. I don't have any more questions there, but I have some other questions of my own. So I would like to throw to all of you to ask, what do you think has been the impact on women in particular, both as medical professionals, but also as patients? What do you think has been the impact on women as a result of the pandemic? Okay, so Anita,
أنا كنت لسه هقول لك الناس هنا ما
I can hear some noise. Okay, Anita, I'll start with you. What do you think's been the impact on women on you as professionals, as medical professionals, but also on your patients?
I can talk to my they feel lonely. I talked to our psychology department. Well, the amount of loneliness, not interacting, not embracing at the times that you feel sick or you feel alone, depriving of the human touch. And we so much long for that human touch that that has been totally cut away. I mean, that has the effect on us, but also on the patient. But we even are having less time with the patients. We have a clock. We can be 2 minutes in the room. We wear a P2 mask. We wear a face shield. All the patients are being swabbed and being tested. And even then, you have no guarantee because we had one corona case in the ward in my shift. I was in quarantine. So then suddenly you're at home. You can start to think about, wow, this is really a crazy year because we are in the mood of working 80, 90 hours. And then suddenly somebody pushes the brake pedal. And then you realize how society is, people with mental disorders or fear or the burden on society will not stop here. It will stretch for the next 10, 20 years, not only in economies, but also how people deal with this impact, like the children going to school and only realize, oh, I have to wear my mouth mask and I cannot interact with other children. I mean, we are not designed that way, but we have to go through that. And I can only support it maximum to give an example to my patients. But sometimes you get rude remarks like, yeah, you don't know, you don't understand anything as a doctor. And yeah, it's the way it is. But I see many factors of loneliness among patients and people, and it is not making people better. Or yeah.
Thank you for that. That's very interesting. Yahra, I'll shoot over to you next.
Well, women in the healthcare sectors were the ones who were affected the most by this COVID-19. No other person on this planet was affected like doctors and nurses during this very critical time. In order to protect the staff, doctors and nurses were supposed to work 2 consecutive weeks at the hospital and then return back home for another 2 weeks. So imagine a nurse or a doctor having to stay away from their family for 2 whole weeks consecutively. Meanwhile, the family where there are children, they are kept at home, not going to school, not being entertained, not going to sports, not doing anything. They're just sitting at home without their mother. And then when the mother comes back home, she's not allowed to play with them or to go out with them or anything because she's afraid that she turns out to be COVID positive and transfer an infection to her family. So most of them, they didn't return back to their home. They just returned back to any other place where they can still be away from the family to protect them. That was for 2 weeks. And then comes their shift again for another 2 weeks. So there are women who haven't seen their families for months. And that was really, really critical. So unlike every other industry, some people could just stay at home and do their work online or just stay at home and not work at all. But doctors and nurses in particular, they were the ones who were affected the most, let alone, of course, those who got infected. They had to stay at hospital without any support from the family or without anyone being with them. So it was really this category of people, the women in this particular healthcare field, they need a really big shout out for what they've been through and what they're still going to go through afterwards.
Thank you very much. Thank you. That's a great reminder of the real human impact and the human effects of COVID. Yu-Ying, over to you. What do you think the impact on women, including on yourselves as health professionals?
I need to say that because I'm not yet married, but I want to share the experience in our hospital because I have a senior surgeon who is going to deliver her baby, and she was told that after delivery, you can't hold your baby for 2 weeks. So that is really difficult for a mother. If you just delivered your baby and you can't hold it for 2 weeks, you can have breastfeeding, and you can't hold your baby like the normal mother does. So she was quite upset, and the hospital told her that, or if you really want to hold your baby, then you have to quarantine for like 14 days before your delivery. Then then if you are proof that you are negative, then you can hold your baby. So I really think that it is quite difficult for women, because just like Yahra said, that you got the issue of children, and you got issue of your family cares, and that is more difficult for women compared with men. And but I think women has more I think women has more patient in patient care sometimes. I'm not quite sure that if this is if my concept is wrong, but I think sometimes women have more patient and more considerate to patient. So sometimes you get more interaction with patients, and you expose yourself into the more risky environment. And I think this is quite difficult for women in this large big COVID war, this big environment. And Taiwan actually accumulate less case of COVID-19, but I really feel very sorry for maybe some European country or USA, because there's lots of cases, and I really hope that everybody can be very healthy. And I'm really glad that the vaccine is just on the way. And I think this will really change the development of COVID-19 combat.
Yeah, thank you so much for that, for sharing that heartwarming story. And I think that's something that has played out right across the world in so many countries. I've heard similar kind of stories where people have been like separated from a newborn, from their own newborn baby. And Yahra, you talked a lot also about that human impact and not being able to sort of embrace your children when you go home. And Anita, you know, you've talked about, you know, just that interaction with the patients and the need for care and connectedness, even if it means you get the negative comments sometimes. And I think, you know, and I applaud all of you as frontline professionals in the medical industry. I mean, just being able to absorb all of that distress and that passion and those problems and those challenges that you all face on a daily basis, and even just putting your own lives at risk. I mean, we applaud you all so much for keeping the rest of us safe. So thank you so much. Thank you for sharing your stories, your inspirations. It's been absolutely brilliant. And I've very, very much enjoyed having you all as panelists today. So thank you so much. I'm now going to pass over to the next session to Linda with the Youth Women Entrepreneurs. Thank you and bye from me.
Thank you.